All right, get ready for this deep dive. We're tackling a fascinating challenge
Oh,
today.
yeah.
Our mission is to help you, a skeptical public health epidemiologist,
hmm
understand Reda Sadki's new framework.
Sounds like a plan.
He says we should think of AI as a partner in global health, not just another tool.
Not just another tool, huh? That's an interesting way to put it.
We're diving into a few of his articles. You familiar with his work on climate change and health?
I've seen some of it, yeah.
Okay, and how about Teach to Reach? That's this huge peer learning platform for health workers he's involved with.
Ah, Teach to Reach. Yeah, I've heard of that. It's pretty impressive, the scale of it.
That is right.
Yeah.
60,000 plus health workers, mostly government workers in district hospitals and clinics across 82 countries.
82 countries. Wow, I didn't realize it was that widespread. I know they've even got people participating from conflict zones.
That's what I mean. It's pretty amazing. Think about it. You could have a nurse in rural Nigeria, a policymaker in India, and a WHO expert all connecting and sharing ideas.
Yeah, that's Sadki's whole point about knowledge exchange, right? Breaking down those silos and fostering collaboration.
Exactly. And it's not just theoretical either. He gives actual examples of how Teach to Reach has made a real difference. Like in Nigeria, one participant redesigned their whole immunization program based on what they learned from other health workers on the platform.
Really? What happened?
Well, they ended up reaching communities that had been totally missed before. Pretty impactful, right?
Yeah, that's what he calls collective intelligence in action, right? Solutions coming from the combined knowledge of many, not just one expert. And that's where AI comes in, he says.
Okay, but how? It still feels like a jump to go from peer-to-peer learning to AI being an actual partner.
Well, think about climate change. It's creating all sorts of challenges for health workers on the ground.
Yeah, definitely. It's causing so many problems. Shifting disease patterns, extreme weather events, you name it.
Right, and Teach to Reach has already helped them share what they're seeing and compare strategies for adapting.
I see what you mean, yeah. Because what works in one place might not work in another. You need that localized knowledge.
Exactly. So imagine an AI system that could actually engage in a dialogue with these health workers.
A dialogue. So not just analyzing data, but actually interacting with people.
Right. Imagine it could process their observations on those changing disease patterns you mentioned.
Okay, I'm following you.
Then it could cross-reference that with emerging data from other regions.
Okay, so it's like a super-powered research assistant.
Kind of, yeah. And then, get this, it could help model the potential impact of different interventions.
Wow, that would be helpful.
This is where he moves beyond AI as a tool to AI as a coworker. It's like it's actively contributing to the problem solving.
So it's not about replacing the epidemiologist's expertise, it's about adding another layer of analysis and insight.
That's exactly it. But I bet you're wondering, doesn't this risk creating a top-down situation?
Well, yeah, that's my next question. How do we make sure AI isn't dictating solutions to communities?
You're right to be skeptical. That's a valid concern, and Sadki addresses it directly. He's very clear that AI should be used to support, not replace, local leadership.
Okay, that makes sense. So how does he see that playing out?
He envisions AI participating in these learning networks alongside humans, almost like an equal member of the team.
An equal member. So it's not just a tool that we use, it's actually part of the team.
Right. He sees it as enhancing collective intelligence, helping everyone adapt to new challenges faster and always being sensitive to the local context.
I like that, but do you have any real-world examples of this kind of AI partnership in action?
He does. He points to the COVID-19 Peer Hub. Have you heard of that?
Yeah, wasn't that another initiative from the Geneva Learning Foundation, the same group behind Teach to Reach?
Yep, that's the one.
I remember reading that they connected thousands of health professionals during the pandemic to share insights and stuff.
Over 6,000, actually, and they were sharing insights, adapting strategies all in real time. You know what Sadki says? He says that kind of networked response, it actually led to implementation that was 7 times faster than if everyone had been working alone.
7 times faster. Wow, that's impressive.
Right. And he thinks incorporating AI into these networks could make that impact even bigger.
That's a pretty bold claim. I still have to wonder, though, how do we ensure this doesn't just become another tech solution that gets imposed on communities?
It's a valid point, and Sadki really emphasizes that for AI to be a true partner, it has to be implemented in a way that respects local knowledge, and that prioritizes community ownership.
So it's not about giving communities some AI. It's about giving them AI they helped shape and control.
You got it. But the question is, how do we make that happen? And what does it mean for someone like our listener, a public health epidemiologist who's working on the ground?
That's what I'm thinking. How does this actually translate to their day-to-day work?
That's where things get interesting. Picture this. You've got an AI partner that helps you make sense of complex data sets.
Okay, I'm listening.
Maybe it helps you spot outbreaks early, or maybe it helps you figure out where resources are most needed.
That would be incredibly useful, especially if you're working with limited resources, which, let's be honest, a lot of public health folks are.
Exactly. Or imagine maybe it connects you with other epidemiologists around the world who are dealing with similar challenges.
So it's like a global network of expertise.
Exactly.
Yeah.
It's all about breaking down those silos and making knowledge sharing easier. Sadki talks about AI helping to tailor solutions to specific communities, too.
Oh, that's interesting.
Right. It's all about making sure that interventions are culturally appropriate and actually work.
I can see how valuable that would be, especially for epidemiologists working in challenging environments where they have to navigate different cultural contexts.
Right. And here's another thing. Sadki advocates for specific principles to guide how we develop and implement these AI partnerships in global health.
Principles, huh? Like what kind of principles?
Well, one big one is maintaining human agency in decision-making. So even though AI might provide insights and recommendations, it's ultimately the human experts who make the call.
That makes sense. We don't want algorithms dictating public health policy, right?
Exactly. Another one is facilitating knowledge flow across those boundaries we talked about. It's not just about AI sharing information with humans. It's about AI helping humans connect with and learn from each other.
So it's about using AI to create a more connected, more collaborative global health community.
You got it. It's a pretty compelling vision, wouldn't you say?
It is, but we've only scratched the surface of Sadki's framework, haven't we? There's still a lot more to unpack.
Oh, absolutely. We've got a lot more to dive into. You're right. There's definitely more to explore here. Let's circle back to what you mentioned earlier about being an epidemiologist. Sadki really emphasizes how AI can help you in your work, not replace you.
Okay, I'm curious. How could AI actually help with something like, say, an outbreak investigation?
Well, he talks about that in one of his articles. Specifically, the potential of AI to analyze those really complex data sets and spot patterns that humans might miss. He uses the term augmented intelligence.
Augmented intelligence. So what does that mean exactly?
It's the idea that AI can actually enhance our cognitive abilities, like, give us a boost.
So it's like having an extra set of eyes, or maybe even a superpowered brain, to help you sift through the data.
Yeah, exactly. Imagine you're in the middle of an outbreak of some mysterious illness.
Been there, done that.
You've got patient data, lab results, environmental factors, the whole 9 yards. It can be overwhelming trying to make sense of it all.
Oh, tell me about it. Outbreak investigations are like solving a puzzle while riding a roller coaster.
That's a great analogy. And time is of the essence, right?
Absolutely. Every minute counts.
Sadki argues that AI could be incredibly valuable in those situations. Like, it could help you process all that information so much faster. And then help you identify potential connections that you might have missed.
So it's like connecting the dots, but at warp speed.
Right. And it could even help you generate hypotheses about the source of the outbreak.
That would be huge. It could help us get a handle on outbreaks much faster, potentially saving lives.
Exactly.
But wouldn't that require sharing sensitive patient data with an AI system?
You're thinking about the privacy issue.
Yeah, exactly. That's a big concern for me.
Well, that's where those principles we talked about come in. Sadki is very clear that data privacy and security are non-negotiable. He envisions AI systems being implemented in a way that protects patient confidentiality.
So how would that work?
Well, they could anonymize the data, or they could use techniques like federated learning, where the data never actually leaves its original location.
Federated learning, that's an interesting concept. I'll have to look into that.
It's definitely worth exploring. But even with those safeguards in place, I'm still a bit skeptical. Epidemiological investigations are so nuanced. It's not just about crunching numbers.
That's what I'm thinking. You have to understand the social and behavioral factors that are at play.
Right, there's a human element that I'm not sure AI can grasp.
Exactly. Can AI really understand the complexities of human behavior and how that contributes to disease transmission?
That's the million-dollar question. And it brings us to one of the most interesting parts of Sadki's framework. He calls it phonesis.
Phronesis. That sounds like a word I haven't heard since my philosophy class in college.
It is a philosophy term. It basically refers to practical wisdom, the ability to make good judgments in tricky situations.
So you're saying AI can't replace human judgment?
That's what Sadki argues. He says that while AI can be amazing at analyzing data, it can't replace that human element of phronesis.
So it's about understanding the limitations of AI and ensuring that human judgment is always at the heart of public health decision-making.
Exactly. It's about finding that balance.
But how do we actually do that? How do we integrate AI into our work without letting it take over?
Well, Sadki suggests that we need to shift our thinking about AI. Instead of seeing it as a replacement for human intelligence, we need to start viewing it as a complement to it.
Okay, so instead of AI versus humans, it's AI and humans working together.
You got it. He uses this analogy of a doctor and a nurse working together.
I like that analogy.
So the doctor, representing human expertise and judgment, is in charge.
Okay.
The nurse, who represents AI, is there to provide support and assistance.
Like what kind of assistance?
Collecting information, running tests, offering insights based on data.
But ultimately, it's the doctor who makes the diagnosis and decides on treatment.
Exactly. AI can definitely enhance our abilities, but it should never replace our role as public health professionals.
This is starting to make a lot more sense to me. It's not about AI taking over. It's about AI helping us be better at what we do.
That's the idea.
But let's bring this back to the practical side of things. We were talking earlier about the challenges of climate change. How does this all fit in with that?
That's a great question. Sadki actually spends a lot of time exploring the intersection of AI and climate change in global health.
So what's his take on that?
He argues that AI could be a real game changer when it comes to adapting to the health impacts of climate change.
Those impacts are becoming increasingly complex and unpredictable.
Exactly. And AI could help us navigate that complexity.
Can you give me a concrete example? How could AI help with something like predicting and preventing heat-related illnesses?
Sure. He talks about the potential of AI to power early warning systems.
Early warning systems, like how would that work?
Imagine a system that combines real-time weather data with health information.
Okay, so it's tracking both the weather and people's health.
Right. And it can identify communities that are at high risk of heat waves before they even happen.
That would be amazing. It could save lives, especially in areas where access to healthcare is already limited.
Absolutely. It could also help target interventions more effectively.
What do you mean by that? Welcome to our deep dive. Today, we're going to be looking at this article by Reda Sadki, and it's about using AI in global health. Now, you might be thinking, AI? What's that got to do with me?
You're a global health epidemiologist, right? A good one. But AI might seem like, I don't know, another world.
Yeah.
But that's what we're here for, to connect the dots between what Sadki's saying and what you're already doing every day.
Yeah. Like you know about climate change, the impact that has on health, and you're already part of networks like Teach to Reach.
Yeah.
That experience you have, that's the key to unlocking what Sadki's talking about.
Exactly. It's almost like Sadki's got this this roadmap, and he's using things you're familiar with, like Teach to Reach, as those, landmarks, so you don't get lost in the AI jargon.
And what's really cool is that Sadki doesn't start by, throwing a bunch of algorithms and data at you.
Yeah.
He actually starts by saying, hey, technology alone, it's not enough. We can't just rely on gadgets to solve these massive health challenges we're facing.
Right. And he actually uses Teach to Reach as an example of how important human skills are. Collaboration, ingenuity, all that stuff.
He really emphasizes that human element.
Yeah.
I mean, he even uses Teach to Reach, which is all about, people connecting and sharing knowledge as this kind of jumping off point for talking about AI.
That's what I found so fascinating. He's not saying, let's replace humans with robots. He's saying, how can AI help us be even better at what we already do well?
That's a good point. And speaking of Teach to Reach, it really is an amazing platform. It connects, thousands of health workers from all over the world, right?
It's like this massive online community, people sharing experiences, brainstorming solutions to these, really tough health challenges.
Right. And I bet you've seen firsthand how powerful that can be.
Absolutely.
I mean, think about the discussions you've had on Teach to Reach about climate change and its impacts, sharing your observations, learning from colleagues in other countries, even coming up with new strategies to use in your own community.
Right. It's that collective intelligence that Sadki thinks AI can supercharge.
So it's like taking what Teach to Reach does so well and giving it a technological boost.
Exactly. He's talking about using AI to connect health workers who are facing similar problems, even if they're, oceans apart.
And AI could also help us make sense of all the data we're collecting in global health. I mean, there's so much information out there. It's overwhelming.
It is.
But AI could help us sift through it, find patterns we might miss, and come up with insights that would take us, forever to figure out on our own.
That makes me think about that article Sadki wrote on climate change and health. He was saying how we need new ways to understand how environmental factors and disease outbreaks are all, linked together. It's complex stuff.
Right.
Could AI be the key to untangling all of that? Could it help us predict the impacts of climate change on health in a more precise way? I think that's what he's getting at. And this brings us to what Sadki really means by AI being a partner. It's not some all-knowing machine that just tells us what to do. It's more like a system that can, analyze complex data, highlight potential problems, and even suggest solutions.
Right.
But it's still us humans, the experts, who make the final call.
That's good to hear. Because as a global health epidemiologist, you understand that every community is different. What works in one place might not work in another.
Absolutely.
You need that human judgment to adapt solutions to specific contexts.
Exactly. And Sadki's very clear about that. He sees AI as a way to enhance what we do, to make us better at our jobs.
Not to replace us.
Exactly.
So it sounds like Sadki's proposing a pretty big shift in how we think about AI in global health. It's not just about number crunching. It's about empowering health workers, fostering collaboration, and ultimately improving health outcomes around the world.
And to do that, we need investment. Sadki argues that we need to be putting resources into developing AI systems that are specifically designed for global health challenges.
Right, tools that are actually useful for the work we're doing on the ground.
Exactly. And just as important, we need to invest in training and capacity building so that health workers like you can actually use these new tools effectively.
It's all about making sure that everyone's on board and knows how to make the most of these new technologies. So it seems like Sadki's really painting this picture of AI as a partner in global health, not a replacement for human expertise, but a powerful tool that can help us tackle some of the biggest health challenges we face. But how does this partnership actually work in practice? What does it look like on the ground? That's something I'm really keen to explore further.
Well, I think a great place to start is with a specific example. Let's talk about pandemic preparedness. Think back to the COVID-19 pandemic. That really showed us, I think, how quickly a new disease can pop up and spread all over the world.
Oh, absolutely.
I mean, it was a huge wake-up call for everyone in global health.
It felt like we were always trying to catch up.
Yeah.
Scrambling to get information, trying to figure out what was going on.
Exactly. And that's where Sadki sees AI making a real difference. He talks about using AI to create these, what he calls intelligent surveillance systems.
Okay, intelligent surveillance.
Yeah. These systems could constantly be scanning data from everywhere, looking for those early warning signs of, potential outbreaks.
So instead of waiting for, hospitals to report cases, we could have AI systems that are looking at news reports, social media posts, even what people are searching for online, and looking for any unusual patterns.
Exactly. And because AI can process information so much faster than we can, it could give us a huge head start in responding to these outbreaks. Imagine knowing about a potential pandemic before it even really gets going.
That sounds amazing. But is it really possible?
Well, that's the kind of potential that Sadki's excited about. It's not about, getting rid of human epidemiologists. It's about giving them a whole new set of tools to be even better at what they do.
Right. So it's like a partnership between humans and AI.
Exactly. And it's not just about early detection either. Sadki also talks about using AI to model how diseases spread.
Oh, that's interesting.
Yeah. So we could predict how an outbreak might evolve, and where the highest risk areas are going to be.
That would be incredibly helpful for making decisions about, where to send resources, travel restrictions, even public health campaigns.
It's about being proactive, right? Not just reacting to outbreaks, but trying to prevent them in the first place.
And potentially saving a lot of lives.
Absolutely.
This all sounds great in theory, but I do wonder about the practical side of things. I mean, we all know that data quality can be a big issue in global health. How can we make sure that these AI systems are getting reliable information?
That's a really important point. Sadki knows that data quality is essential for AI to work. He suggests investing in data infrastructure, and standardizing how data is collected so that it can all be, analyzed together.
It's making sure we have a solid foundation to build on. And then there are the ethical implications, too. How do we protect people's privacy and make sure that these systems aren't being used in ways that discriminate against certain groups?
Absolutely. Those are crucial questions that Sadki doesn't shy away from. He's
Yeah.
really emphasizing the need for strong ethical guidelines, to make sure that AI in global health is being developed and used responsibly.
So it's not just about the technology itself. It's about making sure that it's being used in a way that's fair and equitable for everyone.
Right. It's about using AI to promote good, not to create more problems.
Right. It sounds like Sadki's vision is really about harnessing the power of AI for good. But it's clear that there's a lot of work to do to make sure that happens.
Absolutely. And it's not just on researchers and policymakers, health workers, communities, we all have a role to play.
So we've talked about pandemic preparedness, but Sadki also talks about other areas where AI could be a big help, like climate change. I'm curious to hear more about that. How does he see AI helping us deal with the health impacts of a changing climate?
Well, you know better than anyone how climate change is already affecting health all over the world. We're seeing more heat-related illnesses, changes in when and where diseases break out, more health problems from extreme weather.
Yeah, it's a lot to keep up with.
It is, and that's where Sadki thinks AI can help. He talks about using AI to, analyze climate data and predict how things like temperature and rainfall might affect the spread of diseases.
It's like having a crystal ball, but for disease outbreaks.
Exactly. And especially for countries that, don't have a lot of resources, that kind of early warning could be crucial.
Yeah, if we can predict which areas are most at risk,
Sure.
then we can focus our efforts where they'll have the biggest impact.
Exactly. It's about getting ahead of the curve,
Yeah.
not just waiting for things to get bad and then reacting.
Right, being proactive instead of reactive. Sadki also talks about using AI for early warning systems for climate-related health threats, like heat waves, for example. Could AI help us predict those more accurately so communities have more time to prepare?
That's definitely something people are working on. Imagine a system that, looks at weather patterns, population data, even social media to see where people are talking about the heat.
Right.
And then it could send alerts to, public health officials, community leaders.
So they could set up cooling centers, check on vulnerable people, really get the word out about how to stay safe during a heat wave.
Exactly.
That could be a lifesaver, especially in cities where the heat can be really intense.
Yeah, those urban areas are especially vulnerable. And it's not just about predicting extreme weather either. AI could help us understand those long-term health impacts of climate change, too.
Like what?
Well, Sadki talks about using AI to model the effects of, rising sea levels on coastal communities or how droughts affect food security and nutrition.
Those are huge issues with, ripple effects on health that we're only just starting to understand.
Right. And AI can help us connect those dots, and come up with more holistic strategies to deal with these complex challenges.
It's like AI is this powerful lens that can help us see the bigger picture.
Exactly. It's about using AI to deepen our understanding of how climate change and health are all intertwined.
Right.
Because the more we understand, the better equipped we'll be to make good decisions, develop effective policies and interventions, and ultimately build communities that are more resilient to these challenges.
So we've talked about a lot today. Pandemic preparedness, climate change, how AI can supercharge networks like Teach to Reach. But I want to bring it back to you, the global health expert listening to this. What does all of this mean for your work?
Well, I think Satki's article gives us a glimpse into a future where AI is a key part of global health. But it's important to remember that AI is just a tool. And like any tool, it can be used in good ways and bad ways.
It all depends on how we use it.
Exactly. It's up to us, the people who are developing and using these technologies, to make sure they're being used responsibly and ethically.
You've dedicated your career to improving health in your community. You have that expertise, that understanding of the local context, that commitment to equity. Those are things that AI can't replicate.
Right. AI can enhance your work, but it can't replace the human element.
As you're navigating this new world of AI in global health, I think it's important to approach it with a sense of curiosity, but also a healthy dose of skepticism.
Yeah, ask the tough questions. How are these technologies being developed? Who's benefiting from them? What are the potential risks?
And most importantly, don't be afraid to experiment. See how AI can be integrated into your work, but always keep your focus on the people you serve and the communities you're trying to help.
Sadki's vision of AI as a partner in global health, it's ambitious, but I think it's a vision worth striving for. If we work together, we can use AI to create a healthier, more equitable world for everyone.
And on that note, we're going to wrap up our deep dive into Reda Sadki's vision of AI partnership in global health. We hope you found it informative and maybe even a little bit inspiring.